Alrighty, Class A, we're gonna finish up our discussion on the integumentary system. Stop the integumentary. I can't. Be strong. Be strong. Be strong. But we're gonna finish up our discussion on the integumentary system. So we're gonna talk about this thing called the ABCDEs of skin cancer. So first off, it's fun to say ABCDE. Everyone loves the alphabet. Let's be real about it. But ABCDEs of skin cancer, they do stand for, each letter stands for a certain word. So the A signifies asymmetry. So if a mole is not symmetrical, may be malignant. So may be cancerous. All these the ABCDEs of skin cancer, which are kind of like signs that one may have a cancerous mole. It doesn't guarantee that the mole's malignant or the mole's cancerous, but it is something to be aware of. It's kind of like the quick method or the quick check method to see if a mole may be cancerous. But if the mole is asymmetrical, it's not even on each side, this mole may be malignant. If the border the B stands for border. If the border's uneven, mole may be malignant. So if it's not a clear circle or a clear border to it, the mole may be malignant. Excuse me. C stands for color. So if the mole's very dark or uneven colors, mole may be malignant. Once again, if it's a uniform color, it's probably benign, so it's not much of a concern. Now, if the diameter, which D stands for, if the diameter is greater than, I believe it's 8 millimeters, but just think of a size of a eraser of a pencil. So this is a pen, so this isn't a good example, but the little pink part of a pencil, if the mole is larger than that, the mole may in fact be malignant. If it's smaller, it's probably going to be benign. And then E stands for two things: elevation and evolution. So elevation, if the mole's raised, it may be malignant. If evolution, if the mole is constantly changing, it may be malignant as well. So just because you have one of these signs of potential malignant, mole being malignant, doesn't guarantee it, but it's best advised to see a dermatologist if you are concerned by any stretch of the imagination. These ABCDEs of skin cancer, kind of like the Ask Jeeves or the quick method of seeing if there are potential warning signs of skin cancer. It doesn't confirm, but they definitely are warning signs. So signs don't confirm if a mole's malignant or benign, by any stretch, but if the warning signs do show, especially if multiple, best confirmation is to see a dermatologist. When in doubt, you can never be too safe with your health and with your body. And so those are the ABCDEs of skin cancer. And last but certainly not least, final part of the integumentary system we're gonna talk about is burns. So there's first degree burns, second degree burn, and third degree burns. What the hell does that mean, huh? Well, what does that mean? So I'm going to tell you. So first degree burns is damage, when there's damage to the epidermis. Second degree burns is when there's damage to the epidermis and part of the dermis. And third degree burns is when there's damage to the whole dermis and the whole epidermis. So first degree, just damage to the epidermis, you burn yourself. Second degree burn, damage to the epidermis and part of the dermis. Third degree burn, damage to the whole epidermis and the whole dermis, and it may even extend deeper than that. But some concerns with burns, especially the higher degree ones, are with any of them really, but the higher degree especially, is increased risk of infection. Obviously, there's an opening exposed to the environment. Bacteria can grow, fungus can grow. Just not good things whenever the body's exposed to the environment. They're exposed to some dangerous foreign invaders, if you will. So that's one concern, is infection, and second concern is loss of fluid there. So first degree burn, epidermis; second degree burn, epidermis, part of dermis; third degree burn, whole dermis, whole epidermis, potentially lower. And some concerns of burns are increased risk of infection and loss of fluid as well. So we'll see you back here in our next system. We got the skeletal system up next, but that's the integumentary system. If you have any questions, Get your fingies, get your Guam typing below, and we'll get y'all sorted out before we move on. See you soon.